Hello friends, I am Dr. Shubham. If you're new to this channel, like, share and subscribe. I post videos related to medical content. So today we will be discussing the second part of microbiology, which has been already asked in AIIMS, and it is a recall based topics. So the first question we have is, why do we prefer CLED upon McConkey? The reason for this is because CLED allows the growth of staph and candida. So the second question, a patient coming to you with a rash, headache, neck stiffness and fever, definitely it is meningitis. So which organism it can be? So they are saying it's a lens-shaped diplococci, so definitely it is a meningococcus. If it is a gram-negative diplococcus kidney-shaped, then you will make the diagnosis of gonococcus, right? So the next question is upon the which parasitic infection is it? So if we are saying the pernicious anemia will be in a GDP, that is Giardia and D-lactam, and in a hemolytic anemia is with DPL, that is Plasmodium, Babesia and Leishmania. Iron deficiency anemia is seen with Ankylostoma, Nectator and Trichuris. The next thing that we have is a transfusion-related malaria and mother-to-child malaria. So transfusion-related malaria is seen in trophozoa. The infective form is the trophozoites, and in the mother-to-child it is merozoites. And you can see this table for the comparison. It's a very good curated table. The next thing that we have is an obligate intracellular parasite. So Ehrlichia is an obligate intracellular parasite. Then we have a Bartonella, which has to be grown in artificial culture, Trophiloma and Coaxiella. This Coaxiella has been already asked, right? The next question we have is on autoinfection. So autoinfection is seen as a pneumonic chest, capillaria, Cryptosporidium parvum, Entropias, Strongyloides, Tinea solium. The patient coming to you with a brain abscess. So he has a beaded filamentous structure. It is nocardia. The comparison will be in the next few images. Then you have a farmer coming to you with a sinus. Sinus is a very important hint for actinomycetes. The most common one is of the oral cavity, right? Next question is on the Echinococcus granulosa multilocularis, which is used for the screening in the lungs. Otherwise, you can see a question has come that a progressive dyspnea patient coming to you with a cavitation in the lower lobe of the lung, and it has three layers, that is pericyst, ectocyst and endocyst. So it is Echinococcus, right? Echinococcus पे बहुत commonly question आते हैं. Now look at this image. So what you see a question mark hook. So as for the name, Leptospira interrogans. So the most important thing that you have to remember for this, it can be impregnated with Fontenay and Levedile stain, right? The next question that we have a patient coming to you with a benign prostate hypertrophy. The catheter was put and after 24 hours blood culture was done, and you saw a swarming motility, which makes the diagnosis of Proteus mirabilis, and the potential question that they have a staghorn stone. Obligate intracellular parasite, we have already talked, Coaxiella, which goes in exanic media. And then patient coming to you with a severe hydrophobia, or brought to you with the severe hydrophobia, it is a rabies, and for this the diagnosis is indirect immunofluorescence. Coming to you again, the question on dengue, the patient presenting to you on day 3, very important. So on day 3, 3 tests are done. One is NS1 antigen, other is the viral culture, and the third one is a RT-PCR. Which test is not done? Your ELISA is never done. ELISA is never done because the IgM peak come on day 10, and if the antibody has risen significantly, that means it's an acute phase of infection, right? After this, a microscopic picture which is giving you a plano-convex image, definitely the diagnosis is Entropius vermicularis. It is a non-bile stained, it floats on salt solution, and infective form is embryonated eggs. The next question we have is that why in falciparum you do not see the schizones in the late stage? The reason for this is the adherence, right? The next important question is in Strongyloides, which is the most common feature. So you should know that Strongyloides has a pulmonary phase, so the most common feature will be pneumonitis. The next question is on gram-negative diplococci, kidney-shaped, it is Neisseria gonorrhoeae, right? Now again the question on malaria, you see a ring with the normal shape of the RBCs with the Schoffer dots, definitely Plasmodium falciparum. In the early stage you see a ring erythrocyte as well. Now coming to you with the hexacanth embryo. The hexacanth embryo is a very important feature of Hymenopus nana. A patient coming to you who is HIV positive, watery diarrhea, adenophagia. So the question was, the female has undergone parthenogenesis. The next question, very important, again a hint based question. IUCD users will have actinomycetes, easy. The next question, again fever, headache, you make a diagnosis of meningitis. rash, come to meningococcus. Gram-positive diplococci, flame-shaped streptococcus pneumoniae. Bloody diarrhea, very important hint for amoebiasis. The next question is the comparison between the actinomycetes and nocardia. You have to by hearted because definitely this question gets repeated very frequently, right? Next question, we will talk about the cuttings which is done by papain and which is done by pepsin. So papain cuts in 3 regions, 2 FAB segments and 1 FC segment, but pepsin cuts 1 segment, that is FAB2. Very important, again by hearted. The next question is on the genital ulcers. Again a repeat question every time. So you see they have a granuloma inguinal like a picture. It's a Klebsiella granulomatosis. 3 very important H. dickeri, that is H. dickeri. So they have a chancroids and a skull of fish appearance. Neisseria we have already told, and then Klebsiella gram negative rods with macrophages. Papain, pepsin we have already done. The next question is on the life cycle of Fistula hepatica. Hepatica means liver. So liver fluke. Liver के साथ क्या है? Bile passage. So adult has a bile passage of sheep, and infective form is very important. It is metacercaria. First intermediate host snail. Second intermediate host aquatic vegetation. Right, and very important is the treatment: bithinol, ticlobendazole, and dihydroemetin. Right, and very important ढक्कन होता है इनके ऊपर, so they are known as operculated eggs. The next question, thorn. So from the thorn, it comes in our mind, okay, it can be your sporothrix or it can be chromoblastomycosis, but they have given the second hint of copper penny. Very important, chromoblastomycosis, which is a tementitious fungi, right? The next important question is on a patient coming to you with a 10-day diarrhea and he was on multiple antibiotics. So which fecal sample you will take to make the diagnosis of Clostridium difficile? So you have to do a ELISA for this, for detection of toxins. PCR you will do for detection of genes, right? The next question, there is a rash. It is on lips, that is on mouth, it is on buccal mucosa, mouth, and hands and foot. Hand, foot, mouth disease, hypangina, Coxsackie A, very important. The next question is a patient coming to you with a HIV. She is an HIV patient and she has a diarrhea. So you give trimethoprim sulfamethoxazole and diarrhea was gone. So definitely you can make the diagnosis that it can be PCP, but wait, they have given you the bone marrow aspirate, which looks like a histoplasma capsulatum, right? So it is the question was how it is transmitted. It is transmitted by microcardiaca inhalation, right? It is what? It is a dimorphic fungi. Now Leptospira has endoflagella. Core particle is seen in HPV. Plasmodium has a relapse. So relapse in viva, vivax, and ovale. Then viral hemorrhagic fever in India is the Crimean Congo. Now, which is not a dimorphic fungi? Let's talk of dimorphic fungus. It is Sporostix, Coccidiomycosis, Paracoccidiomycosis, Histoplasma, Blastomyces, Penicillium magnifi, and Candida albicans. They all are very important. Again, a fungal question. Giemsa stain was done, GMS stain was done, and you have an acute angle. So acute angle is seen in Aspergillus, right? The next question, you did a 1,3 beta glucan assay, which is very much diagnostic of invasive candidiasis. Okay, so the detection of lipoarabinomannan in urine is for Mycobacterium tuberculosis, because its cell wall has arabinogalactan, LAM, and your glycolipids. The next question is on aquatic protozoa is your Rhinosporidium seabri. Okay, so they have a sessile polyp, red polyp in nose and nasopharyngeal, in nasopharynx. The next test is very important. See how you will make a diagnosis. So you have an enlarged lymphadenopathy with a sore throat, definitely infectious mononucleosis. Which test examiner confuses you here? The test for this is Paul Bunnell, monospot, heterophile agglutination test. So IgM is done in first 3 months of infection, and इसका जो DD होता है CMV. Again, all the question has been asked. So heterophile agglutination test is antibodies against EBV which cross reacts with sheep RBC, right? So these were the questions. This is a part 2. If you liked the video, like it, share it, subscribe it, and I'll be coming with a new video.